Good morning, everyone. Today we are going to talk about the physiological splitting and splitting of S2. Right? We all know that S2, the second heart sound, is come due to closure of the aortic valve. This is the aortic valve, and this is the pulmonary valve. Right? So valve. What is valve? Valve is basically the elastic structure. When the elastic structure closes, it produces a sound. Opening of the elastic structure never produces a sound. If opening of the valve producing a sound, it is pathological, right? So when the valve close, when these semilunar valves are closed, they produces a sound. S2, right? We can say if we are talking about the S1, in the S1 there is the there is the tricuspid and the mitral valve. They close simultaneously. So S1 is like lub, right? But this is not true for the S2. In the S2, the aortic valve closes first. For example, dub, right? So why this is splitting is come means firstly the aortic valve close, after that the pulmonary valve close, right? There is some delay between the closure. For example, dub, right? Why? Because of the left ventricle is having a thick wall, right? So basically it complete the contraction much earlier as compared to the right ventricle, right? And left ventricle also eject the blood into the aorta, which is the high resistance vessel, and this is into the pulmonary veins or in the pulmonary circulation, which is basically the low pressure circulation. So it will take more time, right, and it is more compliant, right? So basically this is this I want to explain you that this is known as during inspiration what is happening is that venous return to the right ventricle is increased. When the venous return to the right ventricle increases, it take more time to close. So this is known as physiological splitting when there is a delay in pulmonary